Good morning to everyone. I would like to take an opportunity to welcome you to our ribbon cutting ceremony. Appreciate everyone's time and efforts to join us this morning. I do want to take a little bit of time to recognize and thank, I think we have a few dignitaries that are in the room, and I think it's important that we show and extend a warm welcome to them. Mayor Aaron Brown of Forest Park, Chief Alfie Jones of the Forest Park Fire Department, Mr. Greg Kesterman, Health Commissioner for the Hamilton County Public Health, and Julie DeRossi King, who is President and CEO of the Ohio Association of Community Health Centers, and Kelly Carey, who is our Director of Policy and Public Affairs at the Ohio Association of Community Health Centers. So we appreciate their time and attention. We're very excited to showcase for you today a health center that has been in the making for now well over a year and a half or almost 2 years. With the graciousness of Mr. Smith, the time and attention that he has put into ensuring that the student body of the Winton Woods City School District has been able to provide needed services in a efficient and timely manner. This partnership has evolved into what we consider a wonderful opportunity to serve not only the students, the staff, but also the opportunity, because of where we are situated, to serve community members. So we are here really today to talk about what school-based health centers mean. Our goal is to serve those by providing increased access to care, making sure that medical, dental, behavioral health services are all available to students when and where they need those. We are here to also offer support that is a partner with the school district for academic success. So school-based health centers are not necessarily just health care. It is truly about the partnership and the relationship that evolves and develops with schools and health centers or healthcare providers. That goal is to ensure academic success. It's keeping students in the seats when they need to be in their seats to learn. It's ensuring that parents are not having to make decisions about work and getting their students to an appointment and missing that time from their work and or the student from school. So really, when we look at school health, it is designed to be a system of care that is efficient and effective of delivering quality healthcare services. And that's what we are. We are excited about this opportunity to really deliver the utmost care to those students who want and need those services. And I think we will provide to you something that this district has not had previously. And I think you will be quite pleased with what you see today. It is a state-of-the-art school-based health center. It does not have anything lacking from your own private practice offices that you may see both for medical and for oral health or dental services. One of the ways that we were able to make this possible was the fact that we have partners. We have sponsors within this community that rose up to provide the financial support. This is the monetary means to create health centers like this typically either comes from foundational dollars or we apply for assistance at capital monies through state and or federal. We did not have the state or federal dollars available when Mr. Smith and I met, but we were able to go back to our community. And so our community rose up and provided this necessary support to ensure that this beautiful facility that you will be able to take a peek at was available to your students, your community. So many thanks to Interact for Health, Kate Schroeder, and our project officer, Deanna Hillard, who was not able to join us today, but we definitely want to provide an extension of thank you to them for making this possible. And then in addition, we received some foundational dollars from the foundation office at Fifth Third. It was the Oversight Council of the Lewis and Melba Schott Foundation that helped to support some of our medical equipment and supplies that we needed to purchase. So we're very grateful for that support from our community to make this possible. We also want to thank the following individuals for their dedication and helping to bring this vision to a reality. Derek McCormick and Manasseh Robinson with Diversified Facility Solutions, our general contractors. and Michael Conway and Dara Sharp from Sharp Conway Architects, who helped with the design of the facility. And finally, a big shout out to the Healthcare Connections Board of Directors, leadership, and staff who supported us through this process, painfully at times, that helped to make this really possible. We have present with us today Laverne Mitchell, Board Representative, Nanette Bentley, Adam Curry, Linda Childs Jeter, and Denise Pitts from the Healthcare Center Board of Directors. Okay. And to my team that is present, I have Katie Hill, Chief Financial Officer, Chief Dental Officer Dr. Linda Roberts-Riddle, who will oversee the oral health piece, Angie Hartman, our Senior Director of School-Based Health Center and Vision, so that was the piece I forgot to mention. You will see medical, dental, and behavioral health space today. Vision services are on their way. So we will add vision services in the not-so-distant future. And then we have our team that you will meet when you are able to tour. Daniel, our nurse practitioner. Dr. Michael Gerhardt, our dentist. Leslie Hudson, behavioral health provider. And many thanks to Terry Boeing, who is our executive assistant that pulls everything together at the last minute. And our facilities team, who came in behind us and did a lot of cleanup and getting the space ready for today. So with that said, I would like to once again thank you all for your attendance and participation today, welcoming us into this community, and a big thank you to Mr. Smith, who made this very much a possibility for us to join in a partnership, and we appreciate you.
Okay, so here's a quick quiz. Not hard, I think you'll all pass it. How many of you have ever tried to fake that illness where you wanted to stay home but you did feel okay? Well, here you can't do that because we're going to bring that sick kid in and take care of them and make sure that everything is like it's supposed to be. I'd like to take a few minutes to talk about this amazing guy, John Pennycuff. When I became the superintendent 12 years ago, we talked about a health center, and it was his vision to have one. We had the pleasure of visiting Euler. I believe Ms. Ruggles was on the board at the time, and Dr. Johnson and a few other board members, and we visited the Euler Health Center. And one of the things that I realized about the health center, once they put the health center in, academics improved, behavior improved, and attendance improved. So if you can have any of those three factors in a school system, you are going to actually hit a home run or a touchdown or a dunk, whatever sport you want to be part of. But I'm real excited about the healthcare connection because meeting Dr. Joseph, I introduced her to my executive team. And usually when they meet my team, people either they love them or they don't love them. And they met her and they said, that's the one superintendent. She can make this happen for us. And so we're absolutely excited about the opportunity. This is not just for the children, this is for the staff, this is for the community, because schools want to always have this kind of vision, and it's this idea about who is this really for? Who is education for? And we talk about levies and opportunities. People say, I don't want to vote because my kids are already grown. They're already out. Well, this is a community opportunity where it actually takes care of everyone. So I'd like to read a quick proclamation, or at least a senatorial citation from my good friend, Catherine Ingram. I write to extend a special recognition to you on the occasion of the ribbon cutting of Winton School-Based Health Center. Your recognition is well deserved and serves as an honor for your work in the community. The health and well-being of students is a crucial element to their successes, both inside and outside of the classroom. By providing essential services in the most convenient of locations, right here, you are ensuring that students are able to receive the care that will allow them to be the best they can be. Many students struggle to find reliable and accessible healthcare options, but providing this alternative will undoubtedly help students get excellent care from school officials they can trust. As you celebrate this ribbon cutting, know that this new school-based health center will touch countless students. May this milestone serve as an inspiration for all of us to continue working to improve the lives of those in need in our community. Again, I congratulate you on this honorable achievement and extend that best wishes, and that's Catherine Ingram, who is the State Senator, 9th District. So the next part of the vision, we got the healthcare connection, we got the clinic. Wouldn't it be amazing if there was a big hospital right next door? Dream with me. So the one thing that we want to always do is we want to make sure that whatever we do it to the best of our ability. And whenever we do something in our school, it's always about the children. Whenever you lose sight of where you're going, there's probably an issue where you didn't focus on the children. At Winton City Schools, the focus is always the children, and it will always be. And I'd like to bring up the Community Engagement Coordinator, Drew Jackson, who loves to speak in front of people. And what I'd like for Drew to do is to introduce our team, the team of people that served as the Winton Woods board. All right, thank you, Drew.
Good morning, everyone. My name is Drew Jackson. I'm the Community and Public Engagement Coordinator for Winton Woods City Schools. It is an honor to be here today to celebrate and witness the opening of this health center that will have the impact on so many lives. Since I've been working at the district, it has been about creating enrichment opportunities for students and ensuring that they reach their highest potential so they can be future ready. I believe this health center is a testament to the district's commitment to both of the betterment of students and the community it serves. Today, this center will provide access to health services for our students, staff, families, and community members. It's a resource that will aid our families in caring for themselves and their children. In addition, it will provide an opportunity for our students to learn about careers in the healthcare industry during their visits at the health center. Lastly, I want to thank Superintendent Anthony G. Smith, the Healthcare Connection team, and our Winton Woods staff who played a major role in the execution of this momentous project. Thank you. And thank you all for being here this morning. So now we will make our transition to the ribbon cutting ceremony. I'll start with the THCC Board Chair, Dr. Jolene Joseph, Superintendent Anthony G. Smith, and Interact for Health sponsor. So we will do the ribbon cutting in the foyer.
Break a wrist will be our first customers. All right. All right, these scissors are very sharp, so we have to make sure we put these in a safe place.
There's a keeper.
All right, thank you. All right, thank you. All right, so are we ready for a walkthrough?
Yes, absolutely. So obviously this space is not that large, so if we could just break into groups, but we would love to give you a tour. Our team will be located in here to answer questions, but please help yourself to refreshments and mingle for a moment as we get you through as quickly as possible, but we definitely desire for you to take a quick peek at our space and ask lots of questions about what this will mean to all of you. We're very excited. One of the things that we did forget to mention, I forgot to mention, is just so you are aware, that the work doesn't stop today. We have an advisory council that is made up of the district leadership, the healthcare center leadership, parents and students who will continuously provide feedback so that we are learning and we are providing services as needed and wanted and warranted for this district, not something that stops today. So we will continuously have that conversation ongoing throughout the year. We meet monthly. Thank you.
This is just beautiful space.
All of the artwork besides this picture
Yeah.
at the center is student artwork.
Oh!
This is our reception area where we'll schedule patients. We have 2 chair dental opportunities. Free to walk around.
Wow.
We work to get this green. On your left is
Want it green because it goes along with the school colors.
Great, great. Are they blue and green? Just the balloons? I love it. I love it.
Yeah. I know, they could come and talk, you know.
Are you the therapist?
Yes. Yes.
Nice to meet you.
Thank you. Nice to meet you.
Let me know
Bless
when
you.
you're
Okay. This is the for behavioral health. This is a room where kids can come and talk to go over some issues they might have. If they're dealing with anything, they can come into a safe space and talk. And all the artwork is, by the students.
So we've got 2 exam rooms. They're pretty much set up the same. All the equipment kind of mounted on the wall to be able to do, pretty much any assessment that we need to do on a patient. And nice tables and everything, and fully stocked. So. Nice to meet you. I'm a nurse practitioner here.
Oh, that's awesome. Thank you. I'm the board chair for healthcare things.
We're actually in the process of building a new public
Going with him.
Wow, that is a big word. Wow.
Like, what is this whole place?
Yeah. Now, if you need to get your teeth
Like a dentist?
a dentist, and there's a doctor's office. You can come in
When I get
here.
home, I will tell my dad.
You were? Did you see it? Did you like it? Like the green? Yeah. Well, guess what? All of this is from people that go to Winton.
They make some happy.
Well, they made it. I don't know if it was this year, but they
That's
made it.
really cool.
That's very cool.
I'm from
isn't it?
Asia.
You're from Asia? Oh my God.
I'm from South.
Asia?
Is that hello?
Yeah, that's awesome. Yeah.
Let's go.